Hi everybody, welcome to Cut the Kibble. I wanted to do a different video today. Bella had surgery on Tuesday and today is Friday. And I just wanted to tell you about it. So this has nothing to do with like health issues. She had um, a lump on her side. I'm going to show you some videos in a little bit. And 2 years ago, I had a needle aspiration, and it was just a fatty cyst. And she also had some kind of a growth on her eyelid. And the doctor had said, hey, don't do anything. You know, if you want to remove it, do it when you get a dental. So on Tuesday, she went in for a dental, and I had the vet remove the cysts. Let me show you what they look like then. So let me show you. Let me see if I can get a good picture here of her eye. Sometimes it gets angry also. And then this is her lump. And I did get that um, looked at. They did a needle aspiration like 2 years ago, and it was not malignant, just a fatty cyst. But it's getting bigger and it's bothering me, not her. Let me show you what it looks like now. In the second video, I didn't show you the other cyst that was removed because it was pretty small. Anyway, um, what do I want to tell you about this? These are my opinions, but I wanted to share it with you. So, I will never ever give my dog Rimadyl. And I had told this vet that because 4 years ago, Bella had Rimadyl when she had like, I don't know, 17 teeth pulled. Rimadyl is used, it's an anti-inflammatory. Well, Rimadyl kills dogs. And obviously it didn't kill Bella, but it gave her a bleeding ulcer. And that's why she has all these stomach problems now that I have to, be on top of. So the medication that I allowed the vet to give Bella was gabapentin. It's for pain. You got to give something, and it's only for a week. But I was told never to give a NASDAD again. Um, so what do I see? I have everything here. Okay, what I wanted to talk about. So let's talk about the gabapentin was a liquid. Well, I'm not going to be able to give Bella a liquid in a syringe. That's just not going to work. Uh, so what I do is I get bone broth that I make. You could look at my playlist for my videos because you really don't want to buy bone broth in the grocery store because it has onion in it, and onions are not good for dogs. Um, so I did bone broth with a little dehydrated liver in it, and she looks forward to that twice a day. So thank goodness I could give her her pain medication. And you need to have, if you're going to get some kind of eye surgery that you need to do eye drops, and I'm here by myself, I don't have any help right now. You need to have high reward treats, something stinky. So I have some fish treats, and what I do is I have her sit, and I hold the treat up to her, and I have the eye drops, and I have to do an eye drop and an eye gel. And she's pretty good with that. I'm very pleased so far. She also needs to get an antibiotic, and that's a pill. And she's just not going to put a pill in her mouth. And I could crush it and put it in her food. But if you look at my playlist, I just did a video on a pill pocket recipe. It was basically just oat flour and pumpkin and applesauce, coconut oil, and I just stick little pill right in there and make it into a meatball. And she takes it like a champ. So she's getting her antibiotic. Speaking of antibiotics, antibiotics are not great because it kills the good flora in your gut. And in your gut is where around 70% of your immune system is. So you need to have a healthy gut. So prior to having surgery, you should have a probiotic. She does a probiotic. She's had it all her life. I recently switched to Adore Beats Phytos Flora. Look it up. It's the best probiotic out there. But because I knew that she was getting the surgery, but I'm not giving it to her this week because the antibiotic would just kill it out. It's okay. I'm not giving her any supplements this week. The only supplement that I'm giving her is her oils with her food because they're exceptional. Dogs need oil, but it's exceptional for skin. And she had her wounds in her skin, and it's going to help with the inflammation. I use the fish oil, MCT3 oil, and olive oil. And there she is. Can you see Miss Bella? I can't pick her up because I'll hurt her because of her wounds. And I'm scared of her because she will bite me, believe it or not. We'll talk about picking her up in a second. The next thing I wanted to talk about is the cost of this. So I had to pay $1,500 to get a dental. She had no extractions, to get the cyst removed and the 2 lumps, and that was with all the everything, including the cone that I had to get and all the medicines. That's a lot of money, okay? So what I have done, and I've shared this with you before, first you have to find a vet that takes care credit. And the vet that I found did take care credit, and I got the surgery done by the owner, so I felt more comfortable about that. And it's a credit card that you can get. And what they do is, and I didn't realize this, but it's each provider makes their own rules. Because I had her dental done several years ago, it was $1,800 because she had a lot of extractions. And that vet, that provider, allowed me to spread the payments out over 18 months with 0 interest. So I thought I could do that again this time at this new vet. But this provider gave me 3 options. It was 6 months, spreading out at $250 with 0 interest, or I think it was 18 months and 36 months with reduced interest. And I didn't want to pay interest, so I'm doing the 6 months. But I didn't know that. So I wanted to let you know that you have to ask your provider, what are your payment plans with Care Credit? Care Credit's great. My husband used it for himself to get a crown put on. So you can use this for humans as well. So please look into Care Credit. So what am I doing during the day to make sure she's not itching or scratching her wounds? Well, I thought I was going to be putting on a onesie. I did that when she had her spay, and it worked beautifully. But I put it on her when she came home from surgery, and when I tried to unsnap that one snap in the back, she just lost it, and she was very aggressive with me, scared me to death. I had to get a neighbor to come over to help me, distract her with some peanut butter. So I'm not even going to try that now. I have a side eye. I have 3 eyes on me, and I'm watching her like a hawk. And I do put the cone on when she goes to sleep. She sleeps with me. She has the cone on, and I actually have a leash on her during the night so I can hear her and feel if she's, trying to move or take that cone off. Because the vet said it's very important that she does not scratch her eye and open those stitches. And her eye has healed really well in just less than 3 days. But the big thing I wanted to say is what's so important is ramps. Again, I can't pick her up because one of her incisions is right under here where you would pick her up. And so I have ramps all over the house. If she wants to get on the couch, she has to go up the ramp and go down the ramp. If she wants to get in bed, I have a ramp. And look at my playlist. I have 3 different ramps for 3 different places. And you can look in the playlist. I did a ramp video over a year ago. But to me, the ramps are the saving grace of this surgery because I don't want to pick her up. I'm scared to pick her up. I don't want to hurt her because her wounds are tender. So these are all these things you have to look at. And I want to say, I should have said this at the beginning, but dental is so important for a dog's health. I would say, after 4 or 5 years old, you should be getting a dental once a year, maybe every other year, have your vet check. But because there's a direct correlation between dental gum disease and heart and kidney disease, because if the gums get infected, all of those bad germs, they go to your kidneys and to your heart. And there's a lot of dogs that have kidney disease. Somebody needs to do a study if these dogs have had gum disease. So, please, if you have an older dog, you need to get a dental. They'll do blood work to make sure that your dog is okay before they put the dog under. And one more thing, I should have said this earlier too, if you're going to get a dental, you need to find a vet that has dental x-rays. Otherwise, you're just throwing your money down the toilet. They need to look under the roots and under the gums and see what's going on with the roots. That's very important. Anyway, I just wanted to share what's going on with Miss Bella. She's doing great. She's eating her food. I feel that the food that I'm giving her all through her life has built her immunity up, and she is just very strong, and she's healing very nicely so far. So everybody keep your fingers crossed, your paws crossed, and I don't want to turn her. There, Miss Bella, can you say hi? Yeah, there you go. All right, let me know if you have any questions.